Hello and welcome to another video in our series on 2020 CPT Code Manual. Today we're going to focus on the anesthesia section. This section is located immediately after the evaluation and management section of our CPT manual. Codes for the anesthesia section range from 00100 through 01999. Anesthesia services are designed to reflect the services provided by the anesthesia provider. And this is very important because these codes are not to reflect the surgery itself. The surgeon is actually going to utilize a code from the surgery section. Anesthesia services are designed to capture the usual preoperative and postoperative visits that are provided, because they always come and see the patient before, they see the patient after. Anesthesia services also include the care that's rendered during the procedure, because they want to make sure that the patient remains comfortable throughout the procedure. It also includes the administration of fluids and blood and usual, very important, usual monitoring services. And those usual monitoring services include things like EKG, measuring the temperature, the blood pressure, watching the oxygen saturation, because again, they not only want to make sure that the patient remains comfortable, but also that their vitals remain stable throughout the procedure. Of note, it's important to recognize that there are several different professionals that could provide anesthesia services, and those individuals are the anesthesiologist, which is a physician who basically, goes to medical school and then goes to school additionally for, focusing on anesthesia services. But then we also have what are known as qualified non-physician practitioners. And those individuals are anesthesiologist assistants and certified registered nurse anesthetists. I'm pretty sure you probably have heard of this professional before. All right, so next up, let's talk about the different types of anesthesia. So general anesthesia is used for extensive surgeries, and I like to call this like deep anesthesia because the patient is essentially unconscious, so the brain doesn't recognize that somebody's actually cutting on them. And what type of general anesthesia is provided to the patient takes into consideration a lot of factors such as the patient's age and their health. Now, local anesthesia is something that you're going to see for minor surgeries. And basically, the provider will put what we like to call a topical agent on the patient's body or inject something into that area. And the goal is just to basically numb up that area. I think of local anesthesia like when I go to the dentist for a deep cleaning. The last type of anesthesia here in the anesthesia section is known as regional anesthesia. And this is when the doctor needs to block a large part of the body. A example would be when a woman has a baby, they do an epidural. And so they're blocking that area to decrease the pain. All right, a few minutes ago, you heard me mention the usual forms of monitoring. And the usual forms of monitoring are basically what's included when the provider is going to submit an anesthesia code. So again, it's the work before surgery, after surgery, and during, and they're basically making the patient comfortable. Now, there are some services, however, that are not covered under the anesthesia services, and those are called unusual forms of monitoring. And unusual forms of monitoring, if they are provided by the anesthesiologist, that anesthesiologist or certified registered nurse anesthetist can actually bill separately for that service. So some examples are a Swan Ganz catheter, a central venous access device, an arterial line. Those services, if provided by the anesthesiologist, they're billable. Now, when they do perform unusual forms of monitoring, and they're reporting these separate codes, they're going to add a modifier 59 for each code that they're going to assign. And this is basically letting the insurance company know, hey, these services are separate and distinct. All right, next up, we're going to look at anesthesia and time. Anesthesia time, according to the CPT manual, begins when the provider, which is the anesthesiologist or the anesthetist, begins to prepare the patient for the surgery, either in the operating room or similar area. And of note, any time that the provider is like reviewing medical records before the surgery, that's not billable. It's actually part of that preoperative service, because what they do is basically make sure that that patient is good to go for the anesthesia, for the surgery. They don't want to put them under and, you know, they're not stable. So it begins when they begin to prepare the patient, and then it ends when they're no longer personally attending to the patient, and this patient can safely be put into post-anesthetic care supervision. Now, of note, when we're talking about the concept of time, time is reported for payers that follow CPT rules in 15-minute increments. Now, here's the caveat regarding the 15-minute intervals. So once the provider gets, let's just say for one unit, which is, 15 minutes. Once the provider gets to 7.5 or 8 minutes, the provider is said to have reached the midpoint of that service, has passed the midpoint of that service, and therefore qualifies for 1 unit of service. On CMS's website, you can actually get like a little table. So when you're going to, 2 units, 3 units, 4 units, because a provider could have, 4 or 5 hours of anesthesia time. And I'm actually going to show you an example at the end. All right, there are modifiers that are utilized specifically with the anesthesia section. These modifiers are located in your CPT manual anesthesia section. And we actually have 2 types of modifiers. So first, from the CPT manual, we have what are known as physical status modifiers. And physical status modifiers basically identify the patient's condition at the time anesthesia was administered. And as you begin to review the physical status modifiers, you can also see that the higher number, the more complex the anesthesia is potentially for that anesthesiologist, therefore making it a little bit more risky. Now, other modifiers that we have are in the HCPCS manual. And there are, many names for the these modifiers, and they're actually reported before the physical status modifiers. So you would be actually reporting two modifiers. But these modifiers, I like to call them the money modifiers because physical status, it doesn't, it just tells the physical status of the patient. But these money modifiers, sometimes they call them concurrency modifiers. But these modifiers basically tell the insurance company who actually provided the anesthesia. That's why I call them the money modifiers. So for example, modifier AA says that the anesthesiologist actually personally performed the service. And then you have modifier like QZ, which basically says that the service was provided without direction by the CRNA. Now, there's a couple of more that are listed here. And one of the things that I recommend that you do is write these modifiers on and the definition on page 61 in your CPT manual. Oh, also something else I recommend is that you write some of those unusual forms of monitoring codes on the bottom of page 60. That way you have them as a quick reference to refer to while you're coding from this section. The other thing I wanted to talk about was modifier QS and modifier G8, because they use terminology that you may not be familiar with called MAC, or monitored anesthesia care. So MAC, or monitored anesthesia care, is the administration of a variety of local, regional, and other mind-altering drugs by the anesthesiologist or the non-physician anesthetist, aka the CRNA. And this is something that's administered to the patient during a diagnostic or therapeutic procedure. During this MAC, monitored anesthesia care, the anesthesia provider is going to be administering medication through an IV line, and they're going to monitor the patient's comfort level and will increase or decrease the medication as they deem necessary. And so this service, of course, includes a bunch of stuff. So, vital signs and, making sure that the patient is okay, identifying what anesthesia, medications the patient would do good with, and making sure that, that their vitals are stable. This is something that you will commonly see, let's see. Oh, like when a kid has a fracture and they are in the emergency room and they're going to reduce the fracture. A lot of times they'll do that under monitored anesthesia care. All right. So next up, we're going to look at add-on codes that are used with anesthesia services. These add-on codes are known as qualifying circumstances. And they are actually, from a location perspective, they're actually in the medicine section, but we use them with the anesthesia section. And these qualifying circumstances reflect difficult circumstances that really impact how the anesthesia provider is going to provide care today. And those 4 qualifying circumstances are a patient of extreme age, which extreme age is defined as under 1 and over 70. Anesthesia that's complicated by utilization of total body hypothermia. So that means that the body is kept at a lower temperature. Anesthesia complicated by utilization of controlled hypotension. And so here again, notice the word hypo. So the patient's blood pressure is maintained at a controlled low rate. And then lastly, anesthesia that's complicated by emergency situation. And emergency situations or emergency conditions as defined by the CPT manual results when a delay in treatment of the patient would lead to a significant increase in threat to life or a body part. So those are actually not like a modifier, meaning that they are, added on to the modifier. They actually have their own line item on the claim form. So speaking of claim form, here's an example of the CMS 1500 claim form. This is the claim form that is utilized by the provider. And what I want to note is you'll notice that the first line item is the anesthesia code 00210, and then there's that modifier AA. Now on this claim, and this is something that I just grabbed from the internet, they don't have that physical status modifier on there, but the physical status modifier would actually be placed in the next box right here to the right of the AA modifier. And then I also want you to notice on this particular claim form, they wanted 150 units of the anesthesia service. Remember, we talked about anesthesia time. This is a perfect example of how they're reporting that time, but they're reporting it in units. And then I also want you to note that this patient does have a qualifying circumstance code of 99140, which is that anesthesia complicated by emergency condition add-on code. And so again, notice it's on its own line on the claim form, so that it does not function like a modifier. It's actually a reimbursable code. All right, so the last thing that we need to cover is how you actually locate anesthesia codes. And you locate anesthesia codes by going to the main term of anesthesia. And this is very, very, very important. So anesthesia begins on page 904 in the CPT manual. And what you want to do is start there when you're coding for the anesthesiologist. Why, you may ask? Well, first up, remember, anesthesia codes start with a 00. So if you notice on page 904, 905 in your CPT manual, those anesthesia codes start with a 0. So you have to start with the main term of anesthesia, and then your subterm is either going to be the body part, or in some cases could be like a type of procedure. So it could be a replacement. But for the most part, going to the body part is usually how you can capture that anesthesia code. Keep in mind, we don't have that many anesthesia codes, so it may not be a 100% exact match for the procedure, because keep in mind, we're just trying to capture the performance of the anesthesia service. Okay, so main term anesthesia, your subterm is going to be your body part. if I were you, I would take some time and actually look at the options. Nonetheless, you don't want to start with the name of the procedure because you're going to pick up the surgery code. And when you're coding for the anesthesiologist, you want the anesthesia code and not the surgery code. Thank you so much for listening.